Yeah, that's right. You know, and this is critical information to know because you never know when you're going to find yourself in this type of situation. I've got Lieutenant Skylar Belott joining me here, and a big part of what the Milwaukee Fire Department does is you handle these medical emergencies. What are some of the most typical situations that you run into?
Sure. Some of the more common things we see are going to be heart attacks and stroke victims. So some of the more common symptoms and things that we want people to be aware of so that they know how they can help their family with heart attacks are going to be the chest pain, and it can be centralized in your chest. Most people describe it as being a pressure on their chest, an elephant sitting on their chest. You have arm pain, generally speaking, in the left, but it's not always the left. It can be either arm. That pain can go into your jaw, your neck, or even into your back. People feel they'll be sweaty, they'll be anxious. Those are some things that if you feel that, you want to call 911, have the fire department come out. We can have our paramedics take a look at you. We can treat you for those symptoms right away in the field, the same as they would in the hospital. Another thing that we come across often is strokes. And if you find a family member or if yourself you realize that you're having some of these symptoms, you want to call us right away because the earlier you treat it, the better. And those would be facial droop, slurred speech, numbness or weakness on one side of your body, whether it's an arm or leg or otherwise. If you notice that, you call us right away. There's ways they can treat that to make sure you have the best outcome possible.
And with I believe it was with heart attacks too. Sometimes the symptoms go away once you relax a little bit, and then they could come back. So it's critical that you do get the help that you need.
Right. Yeah. That would be like angina. So it's chest pain that comes on with physical activity, and when the chest pain starts, people tend to relax, sit down, find a way to sort of alleviate their symptoms, and then when that pain goes away, they think they're fine. They may have a deeper condition, something else that's going on that they can go to a doctor and be treated for, and it can be taken care of so that it doesn't escalate or continue into a more serious problem.
Now, this machine right here is called an AED, and these are really critical, and they're at some different businesses and so forth that people can use to really save somebody's life.
Yeah. Recently, the automatic external defibrillators have become a lot more affordable, so people, whether it's schools, businesses, public places, government buildings, they have these in those places so that if there is a heart attack, people have the opportunity to start this advanced care immediately. The great thing about these units here is that they're pretty straightforward. When you turn them on, they tell you exactly what to do. You put the pads in the right place.
Yeah, and they have pictures on the pads too, which is helpful.
It tells you where to go, and then it'll analyze the heart rhythm. If that rhythm indicates that there's a shock advised, the machine will tell you to do that. It tells you to step away, and then you shock your patient, and hopefully you can adjust that rhythm so that they have a better chance to survive while continuing CPR, which we'll get into here shortly.
All righty. Well, Kim, now that we know the signs and symptoms of some of these medical emergencies, coming up we are going to be learning CPR, and maybe we're even going to put you